For thousands of years, scientists and physicians have been documenting the condition now known as diabetes. From the origin to its discovery to the dramatic breakthroughs in the treatment, many brilliant minds have played a part in the fascinating history of diabetes. The first known mention of diabetes symptoms was in 1552 BC when Hazley Raw, an Egyptian physician, documented frequent urination as a symptom of a mysterious disease that also caused emancipation. Also, around this time, Asian healers noted that ants seemed to be attracted to the urine of people with this disease. They called it Marhameha, which means honey-like urine. In the 2nd century AD, Artias, a Greek physician of Cappadocia, provided the first accurate description of diabetes, coining the term diabetes, while in the 17th century, Thomas Willis added the term mellitus to the disease. In an attempt to describe the extremely sweet taste of urine, from then on, physicians began to gain a better understanding of diabetes. Centuries later, people known as water tasters diagnosed diabetes by testing the urine of people suspected to have the disease. If urine tasted sweet, diabetes was diagnosed. To acknowledge this feature, in 1675, the word mellitus, meaning honey, was added to the name diabetes, meaning siphon. It wasn't until the 1800s that scientists developed a chemical test to detect the presence of sugar in the urine. Later in the 1910s, Sir Edward Albert Schaffer proposed that diabetes develops when there was a lack of a particular chemical the pancreas produces. He called it insulin, meaning islet, because the cells in the islets of Langerhans in the pancreas produce it. Insulin was later discovered by Sir Frederick G. Baptist and Charles H. Best and J.J.R. McLeod at the University of Toronto in 1921, and it was later purified by James B. Phillips. It was one of the greatest medical breakthroughs in history, which went on to save millions of lives around the world and trigger a century of diabetes discoveries. On November 10, 1921, Frederick and Charles Best introduced extract of pancreatic islet cells from healthy dogs into dogs with diabetes. They successfully treated a dog with diabetes with their insulin extract for 2 days. Doing this reversed diabetes and marked the discovery of a hormone, insulin. Insulin was first used on January 11, 1922 on a person with diabetes. Leonardo Thompson, a 14-year-old boy dying from type 1 diabetes, became the first person to receive the first injection of insulin. Later in 1936, Howard Hemsworth finally distinguished between the two types of diabetes. According to writings published by his son, Richard, on diabetic medicine, he defined them as insulin sensitives and insulin insensitives. Today, these classifications are commonly referred today as type 1 diabetes and type 2 diabetes. The exact cause of most types of diabetes is unknown. In all cases, sugar builds up in the bloodstream. This is because the pancreas does not produce enough insulin. Both type 1 diabetes and type 2 diabetes may be caused by a combination of genetic or environmental factors. Oftentimes, people will ask what's worse to have, type 1 diabetes, type 2 diabetes. Type 1 diabetes is considered to be the worst. It is an autoimmune disease, so there is no cure. Also, in 2010, reports from the UK, it estimates that the expectancy of life for people that have type 2 diabetes is 10 years, while type 1 diabetes can reduce lifespan by 20 years or more. The main symptoms of diabetes are feeling very thirsty, urinating more frequently than usual, practically at night, and feeling very tired all the time. These are some facts that we know about diabetes. Diabetes is the leading cause of blindness worldwide. Adults with diabetes are twice as likely to die from heart disease or strokes. Millions of Americans have type 1 diabetes. Many early symptoms of diabetes are too mild to notice. Half of all these with diabetes are undiagnosed. 37.3 million people, or 11.3% of the United States population, have diabetes. An estimated 28.7 million people, or 28.5% of the population, have diagnosed diabetes. Approximately 8.5 million people have diabetes but have not been diagnosed. There could be several explanations for the rise in type 2 diabetes, including the increased prevalence of childhood obesity. The presence of diabetes in people of childbearing age might be another important factor because maternal diabetes increases the risk of diabetes in children. Today, insulin is still the primary therapy used to treat type 1 diabetes. Other medications have since been developed to help control blood glucose. Diabetic patients can now test their blood sugars at home, use dietary changes, regular exercise, insulin, and other medications to precisely control blood glucose, thereby reducing the risk of healthcare complications. Let's keep in mind that a healthy lifestyle can be type 2 diabetes. Let's keep in mind that a healthy lifestyle can prevent diabetes.